When I began my career in cancer research, there was limited understanding of the role of physical activity in cancer control. I had previously worked on the role of smoking and dietary intake in cancer etiology, and when I began my career in Calgary, I realized that there was an opportunity to work on physical activity. I was very fortunate to meet Kerry Curnier, who was also just starting his career at the University of Calgary, and together we set out a theoretical framework to study the role of physical activity across the cancer experience, from prevention to survival. We began by conducting retrospective studies and then moved to randomized controlled trials. At the beginning, it was challenging since we encountered open skepticism from our medical colleagues. We persevered and have now conducted over 45 studies together that have examined physical activity and its role in cancer etiology, as well as exercise trials for cancer prevention, coping, and rehabilitation during treatment, and most recently on survival outcomes. We were able to conduct the first studies in Canada and sometimes in the world to demonstrate that physical activity reduces the risk of several cancers and that exercise can be used to improve coping, rehabilitation, quality of life, and survival after cancer. After more than 30 years working in this field, we were also able to contribute our knowledge and research in helping to develop physical activity guidelines for cancer prevention and survival. My research also focused on understanding the underlying biologic mechanisms that might explain how physical activity is related to developing cancer and how it is related to survival after cancer. What I'm particularly happy about with my research is that we now have much broader awareness at a population level and within medicine of the benefits of physical activity across the cancer continuum. We have moved from skepticism to optimism. Physical activity is accessible to everyone and also empowering, whether someone is aiming to reduce their risk of cancer or trying to improve their outcomes after a cancer diagnosis. It can be incorporated into our lives and allows individuals to take control over their own health and reap the benefit from being physically active, which we now know also includes cancer control. As scientists, we are trained in our disciplines, but not on how to create and manage diverse research teams, projects, and staff. To become a successful leader takes time in learning about leadership, including the attributes of being a great leader, how to develop and implement strategic plans for your own research and department organization, and how to work and adapt to continually changing research landscapes. Developing these management and leadership skills takes effort, but it is worthwhile, not just at a professional, but also personal level.